of the intestinal. So afternoon section, most probably we will continue there are the two concepts which we were mentioned in the Zoom class, that is tooth diagnosis and iridology. That is something is the new to you all. And of course, people used to ask me, why do you see the eyes to the patient? Then today you have the answer. Why do you see to all the patients? And in my life, I have seen the millions of the patients, which I could see the various kind of the vision. But in that, so how we need to take up to the practical level, we're going to see. So hopefully you understand. Then this is the topic from the morning to till evening, and most probably tooth diagnosis, if the situation permits me, the time allocate me, and definitely I'll take up that, or we will proceed for the iridology. Now, the small intestine is the part of the alimentary system or the digestive system, isn't it? The alimentary system is the biggest system, one of the biggest system. No doubt the nervous system is the biggest system, by the way. And this alimentary system also, it starts from the mouth and it ends on the anal region. And in this one part to be known as a teno-intestinal orb. Teno means the small, intestine means is the colon, and then orb, O-R-B, means is the organ. Right, now, rather than using as a SI meridian, even you can use as a TI meridian as well in your whenever you want it to write. That is optional again. The small intestine is the one of the biggest and also longest organ to be known as in the alimentary system, because there are the numerous parts are there in the alimentary system. If you can see that internally, there are nearly 6 to 7 meters long lengthy of the colon to be known as a intestine. By the way, it is nearly 20 to 22 feet long, lengthy of the colon. You just capture from here, then it goes to till you, then we can recognize that yes, this so much big colon is there in the body. So right, the large intestine is smaller than the small intestine. The small intestine is more longer in generally, but the width wise, the width is bigger is the colon, large colon. The width is smaller colon is lesser than the large colon. So hopefully this is the what is the main different parts of the body. So where exactly the small intestine is divided into, in generally there are the three parts. One part to be known as a duodenum, the second part to be known as a ileum, the third part to be known as a jejunum. So the first part to be known as a duodenum. Duodenum is indicating here. Duodenum is indicating is please, hopefully everybody can see the PPT. The stomach, the next part to be known as a duodenum, which is connected. Stomach is different, the duodenum is different. It's not like that, but however, it is interconnected directly each other. But after the pyloric sphincter of the stomach, then it connects to the yes, duodenum, that is small intestine. The first part to be known as the duodenum, the second part to be known as the ileum, the third part to be known as the jejunum. So this is the major, what is the major physiological aspect of this? So duodenum, jejunum, what are the blood supplies to this particular intestines? The artery is called as a celiac trunk, mesenteric artery, hepatic portal vein, superior mesenteric vein. So remember always there is the artery which supplies to the colon, that to be known as a mesenteric artery which supplies to the colon. Right. For example, now during the ultrasound scanning, the small children having the issues related to the abdominal pain. So due to that pain, they feel that I do have some kind of the intestinal pain or some kind of the pain. So the pain is indicating perhaps numerous reasons to cause the abdominal pain. But hopefully I'll try to give you more explanation related to that. But however, you understand there is a artery which supplying to the artery which supplies to the colon, that causing the problem, that is because of the artery which is passing to the colon is not good. So due to that reason, there is a stagnation, there is a loop in the colon, that means the mesenteric artery is the reason to cause the small intestine pain, abdominal pain. So hopefully that also we're going to see. There is another artery called as a celiac trunk or the celiac artery, where it starts the celiac trunk and artery. So abdominal aorta, the aorta comes, the descending aorta. From the descending aorta comes to the abdominal aorta. Through that, it comes downwards direction. That get the branches. That branches to be known as a celiac artery. That branches to be known as a renal artery as well, which passing to the kidneys. So therefore, that artery, especially that's called as a celiac artery, is the part of the abdominal aorta. Then further, the mesenteric artery is the branch that goes to the colon. Then the vein which is communicating, that is called as a mesenteric vein. So what does it mean? It takes back the blood from the artery, it goes to the superior region, which is connecting to the inferior vena cava. Then the hepatic portal vein. The portal vein also communicating. That means the toxins which is existing in the small intestine, or maybe which is connected to the purified form of the intestine, that passing the blood from the intestine to the liver. So that is through it goes to the liver. Which vein? Portal vein, right? Then the innervation to be known as a sympathetic parasympathetic nervous system. This is in fact is communicating to the colon. So now you remember there are the nerve because the longest, one of the longest nerve to be known as a vagus nerve as well. The vagus nerve, which starts from the cervical region, then it descends to the thoracic region. From the thoracic region, it goes to the above the diaphragm, communicating to the heart and then pulmonary system. From the lungs, it goes to the below the diaphragm. It goes to the stomach and then all the internal organ it communicates, but it goes reaches to the colon. That is the lower part of the colon. It reaches to the anal region. Then I'll show you how that vagus nerve, that to be known as a 10th nerve, cranial nerve to be known as a vagus nerve, how it's communicating to the intestine. So you remember when the colon having the problem, two things you keep it in the mind according to the modern medicine. One to be known as the which artery supplies to the colon. Come on, guys, in the Zoom. Which artery supplies to the colon? Where you all? I'm audible to you all. Yes.
Mesenteric.
Yes, mesenteric artery. Come on, guys, open your mouth and tell whenever, because when you feel the fatigueness, you just open your mouth, then definitely that your fatigueness and lethargy, what you had, the pendant of the breakfast, or the people who did not have the breakfast, even that urcha will going to open, right? The mesenteric artery, conclusion is mesenteric artery supplies to the, from where it starts, that also there is a branch of the one of the branch to be known as a splanchnic nerve as well. Splanchnic nerve starts from the 8th thoracic vertebra, 9th thoracic vertebra, 10th thoracic vertebra, 11th thoracic vertebra, all the nerves which is passing to the colon as well. It goes to the abdominal region. From the abdominal region, it's communicating to the, it's connecting to the colon as well. So from the spinal cord, it's communicating to the, these are the paraspinal nerves, where the half tune lateral to the lower border of the spinous process of the each vertebra, that having the connectivity from half tune lateral to the spine. From here, this communicating to the abdominal system. It's communicating to the colon. So therefore, whenever there is a nerve related impacted or the artery got impacted, then you just treat here. But by the way, there are the nerve also. But however, the artery is communicating from the front region, the nerve is communicating from the back region. That's called as a sympathetic ganglia, sympathetic nervous system communicating here. So hopefully you understand when. For example, now there are the 2 points I wanted to tell you as a local points to treat for them. There is a on the stomach meridian, that's called as a Tian Shu Ta Chu Shoi Ta Po Lai Chi Chung. Stomach 25, 26, 27, 28. But stomach 27, Dachu, and then stomach 29, Kulai. There are the 2 local points to treat for the colon as well. So therefore, so where exactly there is the vagus now or the mesenteric artery, you just activate it from here to here, front and back. Then use give the command to the local points which is communicating to the colon. Hopefully, now the people today I'm practicing without medicine, but the people are benefiting. What could be the reason? I'm not using only the TCM. I'm not using the one acupuncture, but I just integrated with the support of the modern medicine as well. Modern medicine is not the property of only the modern medicine, but all the practitioners need to be understand the anatomy and physiological aspect is very much essential to understand and then implement in our clinical practice as well. Hopefully you understand. The people will get. Then why do we get the abdominal pain? Roundworm is the reason to cause the abdominal pain. Hookworm is the reason to cause the abdominal pain. Tapeworm is the reason to cause the abdominal pain, isn't it? The tapeworm, hookworm, pinworm is the reason to cause the abdominal pain. So there are the worms infestation also reason to cause the pain. Then you have to understand, yes, perhaps is the person is getting too much hungry, but he had just now, after 1 hour, he's crazy that he wanted to eat. But he go to somewhere where he can see the food, but the foodie person, he wanted to eat. The reason is the tapeworm is existing in the colon, could be the reason he's getting the hungry. The person is getting, I think some people, parents are telling, he always like to eat the rice. He always like to eat raw rice. Then he wanted to take the bricks, or he wanted to take the soil, or he wanted to take the mud or something like that. But the strange, but however, he have the desire to eat could be the reason. He have the hookworms in the colon is the reason to cause that kind of the strange things now we wanted to eat. No doubt the anemia and iron and ferritin also reason to cause that related problem. There is a secondly, we try to understand, there is the tapeworms. The tapeworms, the person having some kind of the, which I told you is the hungry. There is another pin. The reason is the person will get the anal itching. So whenever he passes stool, or maybe he's sitting on the audience, now people are somewhere you are sitting and kind of the itching on the anal region. Perhaps you remember there is the worms which we call as the pinworms is bothering in the colon. Then further there is the roundworms are existing in the colon. Then might be reason is the person will get the abdominal pain, and also he'll get kind of the nausea and puking sensation, and also anorexia. Hyperexia is the different, anorexia is the different. Anorexia is the loss of appetite when the roundworms are existing. So similarly, we try to understand what could be the reason to cause that. Then we try to analyze and understand that is the worms infestation is affected. Even for that condition also, we try to apply some of the points. We do have in the acupuncture, definitely that points also we're going to discuss. Then you treat that also, then treat for the nerve and artery as well. The patient will be benefited. Then the function What are the major physiological functions of the tenointestinal? So, of course, there are the chyme. So, whatever we eat the food, that eating the food to be known as a, you take the chapati, then you take the veggies, then together you are using, that means the cocktail food you are eating like a acidic food, then it goes to the acidic, partially there is a alkaline food and partially there is a acidic food what we are eating. So then it goes enter, then it mixes together. Yes, the that is called as a chapati and then veggies together, mixed together in the stomach, that to be known as a chyme, chyme. So then once it will mix it together, then partially will going to absorb in the abdominal system, especially stomach. So later, so after the absorption, then there is a grinding process to be taken place or the reflex formation in the stomach. Then slowly that goes to the duodenum, that goes to the small intestine. The small intestine further, because the stomach can take the retention of the food is nearly 4 hours or 4 to 5 or 6 hours maximum retention of the food. And the later it is advisable that to feel hungry, because the stomach got empty, then the stomach feel obviously feeling of the hungry, because that gone to the small intestine. Remember, small intestine is the place where the maximum time storage of the food to be taken place. That's the reason people says, you remember that I used to go morning and evening 2 times stool per day. Some people says once in a day. Some people says 2 days once I go for the stool formation. Then I again the patient says 3 days once I'll go for the stool elimination, isn't it? So what does it mean? This is a lot of time. That means our 24 hours are greater than that. The food is got the retention in the small intestine. So however, and also by the way, large intestine, then the food is transferring to the whatever absorption to be taken place from the stomach, what is not absorbed by the stomach, that comes to the small intestine. From the small intestine, then the absorption to be taken place the maximum level, and also the digestion, the pure digestion taken place through the small intestine. So what kind of the digestion? The fat and also lipids and protein, but majorly the protein and then carbs, the digestion taken place through the small intestine. Partially the fat metabolism also taken place in the small intestine. So once the absorption taken place optimistic level with the support of the in the small intestine, what is existing, there is a small projections are existing, the unit of projections are existing, that to be known as a villi. So right, that villi, the millions of the villi is existing in the small intestine, and that those projections are very much essential for absorption and also circulation. Now you think about that heart and small intestine is interconnected. Why is it interconnected? Heart in the thoracic cavity, small intestine is there in the abdominal cavity, but how is it interconnected each other just below to the navel? Then remember, there is a circulation is happening, but here also it is very much essential, the circulation also happening, lymphatic system also existing into that. But however, the food circulation to be taken place and the blood circulation also to be taken place with the support of the small intestine, because whatever absorption taken place in the small intestine, that passing to the liver, indirectly that passing to the liver with the support of the which vein? Portal vein. The small intestine communicating to the liver with the support of the portal vein. The good nutrition, whatever we got the absorption in the small intestine, the transfer to the from the colon to the hepatic organ, with the support of which vein? The portal vein. The good essence is going, but normally the venous system takes the deoxygenated blood, but whereas in portal vein taking the optimistic level, the good amount of the chi, of the energy and the blood is moving to the, no doubt the hepatic artery is also really good, but the portal vein, yes, and also nutrition also, it's a optimistic level is the oxygenated in the portal vein, right? So this is the thing which maximum absorption to be taken place. That's the reason I think today, I think Mr. Sonam Wangchung is, went to the hospital for the 20 days he got the fasting. Isn't 20 days without having any kind of the protein, carb, fat, nothing. He had only the water. With the water, he just done the fasting and without, having anything. You remember the small intestine also supported him, liver also supported for him, but nothing is there because of the circulation is very poor, but the emaciated body, the greater than 10 kgs or the 12 kgs he got, drained out the whole muscles wasting to be taken place without having anything. But however, whatever he had, water also one kind of the energy nourishing to the colon, nourishing to the absorption to be taken place, indirectly supporting to the hepatic organ as well. But however, let's we pray for the good cause, the people whoever take up the any kind of the decision, the nearly we do have the 140 crores people. Among them, one person is taken the challenges, but he wanted to do something for the country. But whether he does good or bad, but he has taken up to that level, he wanted to do something. But however, if there is a genuinity is there, better we all support to him in order to take up the some kind of the action from the government as well. So then further, there is a clinical relations. The people who are suffering for the diarrhea, especially remember the colon constipation is related to the large colon, whereas the diarrhea is related to the small intestine most of the times. So therefore, the people will get diarrhea. Then remember, there is something problem is in the colon, the small colon, maybe the food related problem, or there is related to the food related, the water related issues, or the food toxicity could be the reason to cause. Or maybe sometimes the people who take the food also again two types, yang food and then in food. The people take the more in food. In food is indicating, in food is indicating that's called as a raw food. In food to be known as a alkaline food. Right. So people who consume like a vegetables, there is a cucumber, carrot, beetroot, onion, tomato with the olive oil, without olive oil, all are connected to the alkaline food. Right. When the people consume, no, I think foreign countries, some of the people, they consume the more raw food and some people will take the less cooked food. I think in India is the totally reverse, but we take 10% of the raw food and then is a 90% cooked food, or sometimes is 100% is a cooked food. Whereas in other countries, they consume like a greater than 50% of the food to be known as a alkaline food. And then further they take as a 70, 50% as a cooked food. So during that particular time, small intestine will get the excessive cold, could be the reason to cause the diarrhea as well. So hopefully you understand, people will think that diarrhea is there. So your stomach got excessive heat or intestine. People normally use the word, but here is the different. What you had 24 hours before, try to calculate that according to you, just plan it. So hopefully you understand diarrhea, coldness, excessiveness in the colon, also reason to cause the diarrhea. Then obstructive disorders. So what kind of this? Some kind of the obstruction, food obstruction, absorption is not taken place. So infectious disease like a IBC or the IBD also internally, indirectly interconnected to each other. And also neoplastic growth and congenital conditions and different kinds of the ulcers as well. So most of the times the congenital condition, which I told you, mesenteric artery, there is a mesenteric vein got a stagnation at the time of the birth, or maybe the post birth also chances are there. Then further there is a duodenal ulcers. So perhaps the people says I do have the burning sensation on my chest region. So burning sensation on the chest region, numerous reason, but don't take it very simple way. But cardiac also reason to cause the burning on the chest, and also there are the ulcers also reason to cause the burning sensation. There is a hiatus hernia also reason to cause the burning sensation. There is a GERD, gastroesophageal reflux disease also reason to cause the burning sensation on the chest region. So perhaps the HCl, hydrochloric acid, the secretion to be taken place, but it secretes greater than what the amount is required to the stomach, then that also reason to cause the burning sensation. Therefore, we try to find out what could be the reason. So accordingly, we need to understand the TCM functions of the small intestine. Hopefully, you understand what exactly the concept of the small intestine, isn't it? Now we will proceed for the TCM functions of the small intestine. Now, let me proceed. There are the few concepts we try to understand what we have seen related to the modern medicine. We have seen now we are stepping into the traditional Chinese medicine perspective of a small intestine. Right. Hopefully, we try to analyze certain things. Normally, in this easy way, I'll try to tell you the shoulder pain. Normally, people will get the pain, and we try to understand there is the acromioclavicular joint having some kind of the problem, or maybe the glenoid cavity having some kind of the issues, or maybe there is a shoulder what joint, or maybe the clavicular joint is the reason to cause the pain. Of course, there are the mechanical and numerous reasons to cause the shoulder pain, but the TCM says there is a shoulder pain is there. Try to focus and understand. Perhaps the intestinal colon is the reason to cause the shoulder pain, and also the large intestine is the reason to cause the shoulder pain as well. So therefore, our understanding is something is different. But in this case, remember there are TCM physiology because the meridian or the chinglu originated from the pinky finger. From the pinky finger, it goes to the shoulder. So therefore, it crosses the entire scapular region like a zigzag type. Then that is the reason. A small intestine is the reason to cause the shoulder pain. Whenever you wanted to treat, try to remember that SA also could be the reason. Then further, the small TCM function to be known as a to make the difference between the right and wrong. So what does it mean, right and wrong? To understand the concept of the, so whether the person wanted to take the decision. So that time, for instance, I'll try to give you about this course. The people coming forward to join for the course, whether I'm giving us the free charity of the Zoom classes to the some people we are charging to that. But however, my intention is totally, is that our thought is totally free, that whoever wanted to come, let our knowledge should be shared for the entire globe. And further, the people really, yes, I'm just getting some information, but I need to join or not. Some kind of the dilemma or the confusion when they are perplexed that particular time. So whether this is small intestine, you are thinking that, but small gallbladder also initiating that thinking. Then further, both the internal organs are very crucial. You wanted to take up the right decision or not, that decision to be taken place with the support of the intestinal colon. So therefore, when the small intestine, according to the Chinese terminology, it says that when the person is in the confusion, wanted to take up is the right decision on the right time. So that time, I just am having some kind of the perplexed that time. So a small intestine need to, deficiency would be the reason you are unable to take the right decision on the right time. That you properly wanted to take up the judgment. Yes, I wanted to take out. Just this my way of thinking. Just I wanted to take the decision. Yes, this my final decision. Done is done. So I don't, leave this concept. In that way, the people, yes, I wanted to join the course. You just join the course. But I'm thinking, let's join for this year. Let's join for the next year or the subsequent year. Please remember one thing. It's a thing coming to my mind. Now, it's open to you all. I'm telling you, honestly, when you wanted to learn acupuncture, now openings are there. Please learn, all of you. Once the National Commission for Allied Healthcare Profession Act 2021, already they have done in 2024, there is acupuncture professional incorporated in that act. That is the paramedical sciences or the allied health sciences. If they wanted to bring the rules, that time you cannot study as the part time, but you need to be study as a regular time. And the amount also, it is the higher level what you are doing the course now. That's the reason now its openings are there. People who are really wanted to come forward to study, but now definitely they can take the option. But in this decision is not appropriately. So that time, whenever it's not that, I'm just given as a one example. In the life, you wanted to take up any kind of the decision and action in the family or in the society or anywhere in the life, then definitely when you are unable to take the right decision, you are unable to think something is the innovative, then you remember Dr. Giovanni Massacio says that there are the two internal organ are the reason to cause this kind of the issues. One to be known as the fellal, or is to be known as a gallbladder. There is a small intestine also another reason. So therefore the two internal organ deficiency could be the reason you are unable to take the right decision on the right time. So therefore a small intestine is responsible. Again the points also he said me, one point to be known as a yango, the second point to be known as a chiksu, one to be known as a SI5, the second point to be known as a gallbladder 40. Both the points are really good point to take up to the decision in the optimistic level. Whenever you wanted to think something is the novel, then you wanted to take up the decision also appropriately. Remember, when you are thinking something more, you just keep applying the pressure, or you wanted to apply the needle over that region also advisable. You are the learner, then you just apply the toothpick by giving the point. But this time, today practical, you can see SI5 where the points is exactly located. Then further, all the emotions are connected to the person is today. I think the education or maybe some other people who completed, they are the victory people. The victory is really good. That is a very joyful situation to all of us. The joyness is very much essential. By looking you all, I'm really joyous. I feel the good and happiness. My urja is more. My energy is more to see you all since the whole class is full today. Isn't it? I know there is a reason behind it why the people are here, right? What could be the reason? Come on, guys. Why did you come, all of you? Tell me something. What could be the reason? No answer. Oh, to celebrate Fun Day. Tell me something, yeah. What is? I think some people came that is to collect one or two certificates. Okay.
Sir, to know the methods to improve the health, sir.
To know the methods to improve the.
Health, sir. Sir.
Oh, that's great, sir. Thank you so much. Right. Hopefully, what I'm where I was, the emotions are really essential. When the emotions are more, that also not fruitful. When the emotions are less, that also not fruitful. Right. Always is some kind of the happiness is really essential. Eventually, the people today, why there is a sari. Sari, I remember because of sari. Sari. Not S-O-R-R-Y, by the way. Sari ki spelling ಏನಮ್ಮ S-A-R-Y na? S-A-R-E-E, sorry. But here I remember as a SADI, S-A-D-I, to indicating this is something is issues with the common people, school children, college children, and also for the teenagers, and along with that what we call as a married people, unmarried people, or the grandchildren they do have, but still they have the some kind of the issues. I mean to say everything. See, the life is something is simple, but you cannot exist forever. But this whole universe cannot be exist forever, and the people cannot exist forever, and the things which is existing that also may not exist forever. Then why are you feeling taking to that level? Take it easy. God has given life today. Once after the sleep, once you wake up, that is the new day for you. You don't know whether you're going to live or not live. Then why you wanted to think something more? But of course, ambition, keeping to become the like a prime minister, or we wanted to president for US, but thinking is not a wrong. Thinking is not a wrong, but you can think it. But don't take it that to that level. Yes, may not happen. Then oh my goodness. So thinking also very much essential. At the same time, happiness and less happiness both are really essential timely. But when you are thinking, for example, I'll give you the person who scored in the 10th or 12th or maybe in the degree, he scored greater than 500 out of 500 marks. He got very happiness, but the next examination will become low because he took to the today NEET exam. So he feel that yeah, 715 marks out of 722 children they got it, but they are taken to the extreme level happiness to the brain. The brain will get changes the waves called as a alpha, beta, delta, beta, gamma, theta waves will going to changes abruptly. That causes some kind of the disturbances. There is a waves are there, thunder is there. Thunder is goes to the higher level. Thunder we feel pleasantable. Oh, rain may come, isn't it? Likewise, if the person is taken to the depression, this is the seriously thinking anxiety and depression, but that also reason to cause maybe you have taken that emotions very rapidly to the extreme level. Both are connected to the cardiac system is the monarch for all the organs, whereas in small intestine also reason to cause any kind of the emotional disturbances as well. So here I would like to say, but due to that particular time, the abdominal system, this also to be known as a second brain. This also to be known as a gut. Gut is connected to the brain. So therefore, the brain is here, the gut is here. The second brain to be known as a colon. You know, 90% of the serotonin is known as a happy hormone or secreted. Is secreted at where? In the colon, but 10% of the serotonin is released in the brain. So therefore, it is interconnected each other. Small intestine and then heart, no heart and then brain is interconnected each other. That's the reason. Remember, whenever you have the emotionally related issues, sadness and worries and pensiveness, suspicious, and then anger, rage and resentment and furious, and also overjoyness, underjoyness is melancholy, fear or frightening, and delusion, hallucinations, all or something is related to this some kind of the negativity, or within that negativity there is a positivity as well. But how to take up to that particular level, that's most important. So therefore a small intestine is giving that kind of the emotional to taken care is appropriately is very good. So therefore your emotions keep it safely and happily. Then further the small intestine leads to the emotional distress such as irritability and anxiety. The people will get the anxiety and depression today, and you remember remember there is a reason is small intestine also another reason. So hopefully I told you there are the various worms. What could be roundworms, abdominal pain, and then vomiting. Hookworms are eat the strange objects such as soil, chalk piece, and wax. The pinworms is the anus getting itching, especially in the evening. The tapeworms constantly getting the hungry. So these all whenever the patient feel, no doubt when we get the more hungry, then think about the diabetes mellitus as well, because when he started eating for 4, 6, 7 times per day, then perhaps the emaciated body, the he reduced it. Despite of eating, his weight is not elevating, he's decreasing. Then you remember it is related to the some kind of the worms infestation or maybe diabetes mellitus as well. Then small intestine pathology, excess heat in the small intestine also called as a hot fire transmitting to the small intestine. The excess hot fire in the small intestine also scorches the fluids, causing the painful urination with the scanty and dark colored urination. Remember, this is a key point, but hopefully this explanation with the points I'll tell you how it is interconnected. Now there is a reason is small intestine problem issues which is connecting to the urinary bladder. The urinary bladder energy is over controlling to the small intestine. So therefore, any related issues in the colon or maybe the bladder is interconnected each other because the small intestine is superior to the urinary bladder. So next to the urinary bladder, next to the small intestine, what is existing? The behind that urinary bladder also existing. When the stool passes appropriately, then the urine started coming. No doubt the urine comes first, then you passes the stool, then again urine comes. It's indicating it's given the way and passes to pass the urine, but it is interconnected each other. The possible blood in the urine with the burning sensation during the urination, pain in the throat as well. So therefore, you remember there is any kind of the burning sensation in the urine. Please don't think only about the urinary bladder is the reason to cause. Now you remember the hot fire excessiveness in the small intestine also reason to cause the burning sensation in the urine. So hopefully there are the treatment protocols. I'll let you know later. So now we are talking about the small intestine meridian. Through the small intestine meridian, what are the treatments to be taken place? Treat the issues with the fingers, wrist, and then elbow. Then shoulder issues like a shoulder pain, frozen shoulder, when problems with the rotator cuff. Neck and then shoulder issues like a stiffness of the neck, inability to turn the head, or the occipital headache. Red eyes and also ear-related disorders can be treatable by activating this point. Now you remember the small intestine where it starts, where the energy get terminated. That you can have a look interconnected. That will be you come to know exactly. Now let me see. This is the meridian where it starts. Please you just have a look. It starts from the pinky finger. It starts from the pinky finger. It ascends to the upward direction to the wrist. From the wrist, it goes to the elbow. From the elbow, it goes to the posterior side of the shoulder. Then further, it moves to the scapular region. Then it goes to the neck region. From the back side of the neck comes to the front side of the neck. Then it comes to the cheeks. And finally, the energy get terminated on the yes. You can have a look. This is what does it mean? Yum. Remember is the yum. Yum is indicating in ECG. Remember in ECG electrocardiogram, you can find there is a M kind of the signals or M kind of the waves or W kind of the waves are existing, then it is a serious complication of the cardiac system that to be known as a MI, myocardial infarction. So therefore we should be very careful. Then here also you just imitate that yes, M is indicating or kind of the W is indicating here also to be known as a tenointestinal meridian on the scapular region, right? The primary meridian where it starts and where it get terminated. Let me see. So you just have a look here. Yes, quickly we will proceed for the small information related to the various different types of the channels or different types of the meridian system. Further, we'll move on to the points. Now, SA1 begins to the ulnar side of the forearm, and which already I told you how the energy is moving. From the shoulder region, there is an energy called as the interior energy pathway. From the shoulder region, where the scapula region, so there it communicating to, it comes to the front side of the chest region. From the front side of the chest, it goes to the heart region, because that is a coupled organ of the small intestine to be known as a heart. From the heart, it descends to the downwards direction to the stomach region. From the stomach, it goes to the colon. That's called as the small intestine. From the small intestine, it coming to the downwards direction and communicating to the point to be known as a shang chuk su. Shang means is the metal. Chuksu is the colon. So therefore, small intestine communicating point. I think please all of you have the T. Then there is a lower HEC point of the small intestine to be known as a which point? There is one question in your question. Good. Stomach 39 is the lower HEC point for the small intestine. That's called as a Sia Chuksu, not the Shang Chuksu. Shang means is the large intestine, metal Chuksu, whereas in Sia Chuksu to be known as a small intestine. Sia means small, Chang means the intestine, Shu means the Suksu is the point. So hopefully we can see that where the energy get terminated. Please have in the PPT, you can find the small intestine is the stomach 39 point. If you wanted to treat for the small intestine, treat the first point to be known as a Shauza, that is SI1. This last point to be known as the stomach 39. Use the exit point and then entry point. One point to be known as the entry point is the SI1. The exit point to be known as a, no doubt the exit point is the Tingguang. Here, 19 is the last point. But according to the interior energy pathways, that's communicating to the, yes, communicating to the Siachuksu. Right. Then the branch which already I told you, this is the branch where from the neck region, it communicating to the Chiachuk. So that is a say it in Chuanlio. From the Chuanlio, it's communicating to the vision system, eyes. That's called as a Qingming. From the Qingming, it's entering to the in front of the ear, in front of the ear. So hopefully we have seen this. And also the small intestine primary channel is communicating to the two meridian. One meridian to be known as a small intestine meridian, the second meridian to be known as a UB meridian. Remember is the key point. There is the 6 paid meridians are there. Taiyang, Shaoyang, Yangming, Juyin, Shaoyin, Taiyin. There are the 6 meridians are there. Out of 72 meridians, in that 72 meridians divided into how many meridians? Only the 6 meridians. Those meridians called as the Taiyang, tie-in. All are kind of the formulas, small formulas. I'm giving you as a fruit. By the way, you are having the tea now, but without giving tea, you should drink the Hyderabad tea also. Without giving biryani, you should eat the Hyderabad biryani also. The taste need to be derived through my lecture. Hope everybody will going to eat biryani. ನಿಜವಾಗ್ಲೂ ನೀವು ತಕೊಂಡು ಹೋಗ್ಬೇಕು. It's not that what I'm just giving you as the lecture, but take the taste, delicious taste. That is the education taste. That is the acupuncture taste, the small intestine taste, right? The points, the taste, and also interconnectivity taste. You just take it to your mind, take it to your home, that you go with that essence. That essence is there with you. That definitely that nourishes to your brain. Because why you people are here, why people are in the Zoom, that just take something. But even I'm taking something from you too, that my energy get energized to my brain, my body, with the support of you all. So hopefully Taiyang, then why I mean to say there is a small intestine problems are there, then you need to treat for the Taiyang. There are the balancing system that's called as a the global balancing method. There is called as a there is a Taiwan balancing method, or maybe the method called as a there is a pairing balancing method, or maybe there are the 5 principles of the balancing method is there in acupuncture. So that to be known as this pair meridian, also one of the principle to balance the entire body. When the UB problem is there, don't treat to the UB, treat to the SI Taiyang. Then SI problem is there, don't treat to the SI, treat to the UB meridian. So similarly, there are the novel concepts are there, but I told you hundreds of the different types of the acupuncture. Whenever situation comes to you, try to treat in the different level. Hopefully that also will be going to help you. There is a small intestine 7 that's called as a chin chin. Where is the chin chin point? SI7. SI7, the point is located here. From here, this communicating to the shoulder region. That's called as a remic point. This is called as a luo connecting point or the necessary point, or there is interior and exteriorly communicating point, or the husband and wife is meeting point. That meeting point is here on the SI7. That's communicating one point. So how do you handle and treat communicating to the husband and wife? This SI7, then which point you wanted to activate? Source point of the, which is the source point? Head 7, SI7, and then head 7. 7, 7, you keep it in the mind. Ching, ching, and then shen, men. Both the points are good point to communicate to the husband and wife. The heart is problem, then small intestine is problem. Then vice versa. So therefore, how to handle and treat? You just apply 2 points together. I think in this way, you can treat for the numerous diseases related to pertaining to that particular organ. So hopefully you understand. Then there is SI7 is connecting to the shoulder, any kind of the shoulder pain, because the energy is coming from here on the SI7 that's reaching to the shoulder. So therefore, any shoulder pain, we can use the point to be known as a SI7, but divergent meridian called as a Ching P. Ching means is the Ching means is the energy or the meridian. B means is the divergent. Divergent is the different meridian or the which we call as a muscular meridian. Where it starts, always it starts from the axilla region of the small intestine meridian. It starts from here and reaching to the chest. From the chest, it goes to the small intestine. The energy get terminated. That to be known as a small intestine divergent meridian. Small intestine sinus meridian. That's another meridian. Sinus meridian means is the tendinosus meridian or the musculotendinosus meridian or the very fibrous connective tissue meridian. So that to be known as the sinus. Then there is the, we're going to start on the SI1. It starts and binds on the wrist region. From the wrist, it binds on the elbow. From the elbow, it binds on the scapula, shoulder region. From the shoulder, it covers the entire scapula. From the scapula, it ascends to the neck region. From the neck region, it covers the entire spectrum of the ear. From the ear, it connecting to the called as a, there is a pinchen, that's called as a bention, that is the gallbladder 13. From the 13, it get terminated on the head region. This is called as a sinus meridian. The sinus meridian wanted to treat. Then of the small intestine, the point to be known as a bention, that is the gallbladder 13. Now the points called as a, there are the, how many points? Total number of the points are existing. Those points are 19 points are existing. The first point, how to pronounce the Chinese terminology or the pin-in names of the characteristics of the Chinese Mandarin language. We'll just try to say Shaosa. The first point to be known as a Shaosa, Shaosa, Chianggo, Huxi, Wango, Yango, Yang, Lao, Chin Ching, Xiao. How many points? 8 points. Then is the Chiansen, Chiansen, Now Show. Chiansen is the small intestine 9. Now Shu is the 10. Small intestine 10. Then is the Tiansang. Tiansang. Ping Feng. Then Chu Yuan. Qian Wai Shu. Qian Chung Shu. Then further Tian Rang. Tian Chung. And Chuan Liu. Tingang. How many points totally? 19 points are existing in the small intestine meridian. So hopefully we're going to see one by one where the points are located. So there are the certain nerves which also need to be understood. So on the palm, there are the certain arteries and venous system is existing. That's called as a digital nerve. The digital nerve, digital vein, and digital artery which passes to the small the finger. Then further we're going to see. Yes. So we'll proceed now, and all of you, please relax for a minute. You just give big round of the applause, and then please be seated. Then we'll proceed for the points. Now we're going to cover the theoretical part of the small intestine, 19 points. So break is how many minutes is break? 1 minute is the break. So ಎದ್ದೇಳಿ ಬೇಗ ಎಲ್ಲಾರು ಎದ್ದೇಳೋಕೆಲ್ಲ ಇಷ್ಟು ಲೇಸಿನೆಸ್ ನಾನು ಜೋರಾಗಿ ಹೊಡೀರಿ ಏನ್ ಮಾಡಿರ್ತೀರಾ ನನ್ ಹೊಡೀರಿ I think when I take up to the practical section, that time I'll try to give you more information. But right now, you take the two information. One to be known as a theoretical aspect, the second to be known as a practical aspect. But when I wanted to tell you theory, so that time I'll take you some information. Then I go to the practical. I think integratedly you will get the more knowledge as well. So I cover this and I cover the extraordinary information as well, because that time I wanted to give you something more, but this time I wanted to give you theoretical as well. So therefore, you just do the theoretical part. I go like a bullet train, then I go for the practical also. But together, hopefully you can understand optimistic level, then you can handle certainly by using the some of the points to treat the people who are already completed their respective courses. Right. Now, first point to be known as a Shazam. I love this point because day-to-day clinical practice, I use this point to the patients most of the times. The location of the Shazam, point one chun proximal to the ulnar corner of the nail base of the pinky finger to be known as a SI1 point. So SI1 is something is the two conditions, we keep it in the mind. There are the 2 points are there. One to be known as the Taiwan philosophy also says SI1 point is the good point. Hua Si. Shaoza is the 1 point. Hua Si. Hua means is the fire. Si means is the knee. Fire knee point as well. So therefore, there are the 2 meridian or the 2 philosophies are incorporating by using this 1 point to be known as a Shauza. So therefore, SI 1 point where it is starting is the here, but the starting point itself is the small intestine 1. Just to come before that, which meridian we were completed last week? Heart meridian, where it got terminated. Pinky finger on the radial side, H9, that is a Shao Chung. Then this is the Shao Sang. So this point completed here, the energy got transferred to the, then again there is how the arteries will become the capillaries. Capillaries are connecting to the venules. Similarly, the energy is communicating here, completed that energy, the arterial energy of the heart meridian, then it's communicating to the another arterial system to be known as a Shauza, that is the small intestine, because chest to finger, finger to face, face to toe, toe to chest, finger to face. The finger it got terminated. Again, it starts from the finger, then ascends to the upward direction, reaching to the facial region. So now, therefore, the points are connected to the small intestine. One related to the TCM physiological aspect that is called as a metal point or the point called as a air point, and also there is a grand sun point or the sedative point or the depletion point. So this depletion point to be known as a this depletion point to be known as a the depletion point to be known as a decreasing of the energy of the small intestine, or it's just whatever energy is existing. The people says after eating I know my food, then I get bloating, or even I don't feel good hungry to eat as well, because the absorption is not taking place. By the way, the people says the after taking the food also I feel the fatigueness and lethargy, weakness. Maybe after eating I should feel good, but still after that I wanted to go to the bed and take the power nap for some time. So all or some one or other way it is indicating to the colon. So therefore, this is the 1 point is helpful whenever there is a lot of stagnation is there in the colon, wanted to drain out. Because excess energy is there, excess energy need to be drained out by using the point to be known as a sun point, the second point to be known as a grand sun point, or the depletion point, or the decreasing of that energy, or the depleting that essence in the small intestine. So therefore, once it depleted that energy, then obviously now you think about the small intestine meridian. One, you need to think about the organ. The second, think about the meridian pathway that's called as the chingalo. So the energy is stagnated. One organ is stagnated, we understand. The energy gets stagnated on that meridian pathway. Then heaviness on the shoulder, heaviness on the scapular region, heaviness on the neck region. Obviously, then there is some kind of the obstruction or stagnation. Some kind of the flow is not good, properly maintaining in the small intestine, need to be drained out. So when there is always some kind of the disturbances on my scapular region, then you just drain out by using the point to be known as a shausa. There is the draining point, that means the bleeding point. Always bleeding, also one kind of the therapy that's called as a bleeding technique. How the acupuncture hijama is there, like that hijama for the needle also to be taken place. That hijama point to be known as the SI1. No doubt hijama you use the cup, but you can use only the lancet to insert and then drain out. But even last day, yesterday by this time, we drained nearly greater than nearly 100 drops of the blood has come nearly yesterday. That's we applied the one point that is called as a Weichung. Weichung is the UB40. We no only one prick, so it drained it out. It oozed out the blood. So maybe only one prick. So therefore, like that one acupuncture point also works like a hijama or the wet cupping therapy. Similarly, you understand this point is indication for all the breast related disorders as well. The people who are really suffering for the BIRATS 1, 2, 3, the breast imaging data analytical system, that is a BIRATS 1, 2, 3. So even 4, 5 something is the different scenario. Whereas in the first and second level of the lump or the cyst or the nodules are existing in the breast, and especially for the before marriage, the post marriage, girls also getting this kind of the problem, but this will going to support them, so it's going to eradicate. Chances are there, even the post no marriage, the after post birth of the baby, then definitely there is some kind of the lactation. But there is not the pitting swelling, just the muscles swelling is there on that region. Then try to find out, perhaps could be the reason to cause is the breast. The breast kind of the lump or cyst is there. Ask them to analyze and palpate the breast from the downward direction to the upward direction, from the medial direction to lateral direction, from the lateral direction, medial direction to the lateral direction to the medial direction. We always ask them to palpate for the female itself, or the female is practicing yourself, you palpate to the female lady, then you try to find out there is some kind of the nodules are existing. But in that way it's very essential. If that condition is there, even for that also you can use the shausa point is good. And further, yeah, arm, only on the arm, not on the legs, only on the arm. Then further, there is the febrile conditions also can be treatable. Remember, there is the problem is in the pyrexia. Pyrexia is the kind of the febrile condition that to be known as a fever, commonly we say. But that fever is there. What could be the reason in generally? There is a small intestine. A small intestine fire get excessiveness is the reason to cause the temperature elevation. No doubt there is the triple warmer also one of the another reason, but the majorly when the small intestine need to drain out the fire which is existing, the fever also get control. That's the reason SI 1 point bleeding that will going to help to control the and regulate the temperature as well. So of course, since the first point is treatable for the where the ending, this is also again secret I'm telling you. The first point is the where is the origin of the place. Then the last ending point, you keep it in the mind. Ending point where it get terminated in front of the tragus, that's called as a tingong. Tingong is the palace of the hearing. So therefore, once the place where exactly it get completed, then the first point is treatable for the topmost proximal point, topmost distal point as well. Yeah, why fever is responsible for the the small intestine? Yeah, fire element obviously. The heart, yes, yes, and also the no. One reason is the fire element. The second reason, whenever the food energy get stagnated, that convert in the form of the heat energy. But heat energies get because food is got retention most of the times in the colon itself. There is a viral fever. There is some kind of the fever, chronic fever. Fever is not related on the skin. The fever is not related in the heart, but the fever is in the colon could be the reason to cause the typhoid fever most of the times. So therefore, there is a salmonella type and the salmonella paratype also reason to cause that bacteria getting affected in the colon could be the reason. So therefore we wanted to treat because the small intestine is only the acute problem. Fever is the acute problem, not the chronic problem. So therefore the acute conditions we just try to treat for the small intestine always is good. Yes. Yeah, excessive heat in the lungs. There is a complex disease further. If you think about the, because only the fever is different. Fever again is the numerous types, isn't it? Likewise, only the temperature. Remember here, I would like to give you one fever to be known as it. Only the fever, body pain, headache. This is something is different. Fever, cold, congestion is different. The fever and then cough and then phlegm is different, isn't it? Likewise, the bacteria and then virus which is affecting to all these three parameters is slightly different. Only there is a fever and then body pain, headache is the gram negative bacteria, whereas in the fever and congestion and cough and then cold, then the gram negative bacteria is more impacted. So therefore the mixed problem is there, both this and that together, then the gram positive and gram negative bacteria both are affected in the body. So therefore when there is a serious condition, of course the temperature it goes higher than 104 degree Fahrenheit, then it's not advisable. Use this point as a supplementary and supportive, is whether you wanted to take some bacteria is there, some virus is there. For the virus may not be essential for taking the antibiotics course, whereas in only the bacterial infection is there, only you are treating by the acupuncture. I don't recommend you, since that acute condition should not go to the subacute condition. That's the reason antibiotic support is required for 3 days to 5 days in order to suppress or kill that virus bacteria, so that you will get the good relief. Along with that, as a supplementary you wanted to give, definitely give. By the way, antibiotic, you should not supposed to give any kind of the antibiotic to the patient until unless you don't have the qualified registration. Now the second point to be known as a Chianco. The second point to be known as a Chianco. Again, I love this. All the points really I love for all the small intestine meridians, but that's called as a where the point is located. There is the transverse crease of the palm. The crease, the numerous crease. How many creases are there? I'll let you know. First of all, this is the web margin crease. The web margin crease, right? Web margin crease. This is the transverse crease of the palm, and then semiflux, and then turn like this, and then you understand the first palmar crease. That means the web margin crease. Once you close where the crease ends, this point to be known as SI2. But however, if you are unable to understand that point where exactly is located, the Chiangu SI2 point, then definitely I'll show you practically. The SI2 point on the web margin, where exactly on the medial side of the distal to the metacarpophalangeal joint in the depression, that point is located. That point to be known as SI2. So hopefully we'll try to see that SI2 point. Then further SI2 point is the grand mother point, whereas in two different concepts, SI1 is the grandson point, whereas SI2 is the grandmother point. And further after the metal, which element? Water element. Fire, earth, air, water and wood. This is the sequence of the Pancha Mahabhuta. Always you register in your mind. So once the metal is completed, after the metal what is coming? Water is coming. So the second point to be known as a water point. This the water point is indicating here. So then SI2 is equivalent to the UB60 Kun Lun. SI1 is the Shauza is equivalent to the Yang C, that is Li5. SI1 is equivalent to the Li5 because SI1 energy goes to the colon, small intestine energy goes to the large intestine energy, that to be known as the SI1, that goes to the colon, small intestine to large intestine, the energy passes here. But SI2 point, which is communicating to the small intestine and urinary bladder. So therefore, any UB related problem, there is a burning sensation in the urine. There is the people passes the urine very oftenly, but night time I just passes the urine for every 1 hour. I pass the urine every 2 hours. I need to wake up and then go for the washroom. Then in this way, I do get the sleep, but I am unable to sleep appropriately because this is bothering me a lot. That's the reason I just I just use the washroom. But in that way, the people are very oftenly going. That is the fire and also there is a colon energy get disturbed, could be the reason. Then you just activate the point to be known as a Chiangu. By the way, Chiangu point is good point to treat for all the related disorders, finger related disorders. That's called as a the movement related disorders, the paralysis, spasticity related disorders, the flexion and extension not taken place appropriately, all could be the reason to cause. And by the way, the people will get the numbness because of the excessive coldness on that particular region is the reason to cause the numbness. Because this point to be known as a small intestine is the water point is a site to the water get excessiveness in the small intestine meridian, but there is no fire within that. So therefore, that could be the reason the finger get numbness. So numbness is the insufficient chi, insufficient shui, blood to that particular point, fingers. Due to that reason, then you just activate this point to be known as a Chiangu. Is a great point to treat for the numbness and the numbness of the fingers. But once you applied this point, so where you are applying to the lumbrical muscles, but the lumbrical muscles called as the deepest muscles of the palm, deepest muscles of the fingers, that also is going to support to release the spasticity because of the paralysis, and also it clears the heat. So, however, it adductor digiti minimi muscles. These muscles called as a tendon of the abductor. Abductor. This is a adductor. This is a adductor. This is a abductor muscles. This is called as the abductor muscles of the digiti minimi muscles. There is a palmar artery. The palmar vein will going to support to this particular region. When the palmar artery is unable to supply the blood to this finger, then also it causes some kind of the pain, some kind of the inflammation. Sometimes it causes the trigger finger to be known as a, once you do like this, so it unable to open on the voluntarily, but you have to do the mechanically, oh no, oh I have the pain, that indicating there is a trigger finger. Trigger finger again two types. One to be known as a, here there is a nodule because of the nodule on the small intestine region, where exactly on the palm region it gets a nodule. So nodule is the reason to cause the blood obstruction of the blood flow. Again the C8 now, cervical 8 now also reason to cause the trigger finger. You need to activate both to regulate the trigger finger. Easily going to be subsided, will become the normal soon. So then further, there is an important indication to be known as a amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis, the non-curable disease, but that is known as a muscle wasting disease, especially the muscle wasting to be taken place on the upper trapezius muscles. These muscles having some kind of the wasting. Spasticity is the opposite to spasticity to be known as a wasting. So spasticity is the stiffness, rigidity, whereas investing is loose muscles. And also there is now the sonam vamsham. So you have all the muscle wasting, that indicating that muscles are very, very weak because there is no protein, there is no carb, there is no fat, he's not eating anything. So muscle wasting to be taken place. But here also you can understand that especially on these face, which we call as the upper trapezius muscles, and also there is a scalene muscles, levator, scapula muscles. These muscles get wasting. So muscles get wasting, that indicating the muscles are very, very floppy. It got the depression. There is no muscles here. There is no muscles here. The entirely skeletal system you can see. You can see the clavicle. You can see this bone called as a shoulder bone easily. But now the scapula you can see. No supraspine of the scapula you can see. But there is no muscles there. Because of there is no muscles on that region, the deltoid muscles also very big. The biceps muscles also very big. And also the triceps muscles also hanging on that particular time. So this is my way of research. So this point, definitely I taken some support from the modern philosophy as well, and also modern acupuncture as well. But this is as a ALS. So amyotrophic lateral sclerosis. So this point will going to help to strengthen and build up the muscles on the small intestine meridian. Right, wherever there is a stagnation, wherever there is a wasting is there, muscle wasting, that to be rejuvenated, that to be activated by activating the point to be known as a, if you don't understand what is ALS, please you just write down, try to find out, ask to the auntie, ask to the AI, that will going to give you the answer how there is an image. Because I don't get enough time to see all the PPTs and do the presentation appropriately. But it's coming to my mind and I'm telling you, whenever you have the doubt, you try to find out. In the 3 ways I'll give you. One thing you wanted to understand, try to understand with the Google auntie. She will going to tell you with the English meaning. If you don't understand with the English meaning appropriately, then you try to understand in your Kannada language or the Kerala language or some other Hindi language. If you don't understand with to that, then you ask to the Google itself to your own language. Whether you are speaking Telugu, Kannada, Malayalam, whatever you are asking, your respective language, you ask it. One is the regional language, local language, but you try to keep that answer with you. Yes, now I'm perfect to understand what exactly this is. So everything is existing in this universe. Whatever you wanted to take, you can derive it. But only the thing is you have to focus and do the visualization and concentration. So because whenever I'll tell you, maybe it goes above your head, but maybe or it's going above your head now. But once you go to home and then explore, what is this? And definitely you will get the fruitful, ouch, Amma, today I got happiness. I come to know, oh, this is the sir was telling. Isn't it? Then take it to your mind. Then the third point, really, I love too much this point to be known as a hooksy. So hooksy, SI2 itself. So then the third point to be known as a SI3, that is hook C, where the point is located. Look at about the palm. Look at about the palm. On the palm, there are the 5 lines are there. Now I'm palmistry. Palmistry I wanted to teach you. One to be known as a, there is a headline, there is a brain line, there is the lifeline. So don't think about the Kon Banega Crorepati is the lifeline. But however, the lifeline also here also existing. You wanted to win as a 1 crore rupees, but the lifeline is we don't want to take somewhere. But the lifeline, you just check where is your lifeline is good, then you're going to earn 1 crore rupees, isn't it? So now let me see where the palmar crease. This is the main palmar crease to be known as a heart line. The second line to be known as a headline. The third line to be known as a lifeline. There is another line is the fate line. Right. So there are the nearly 4 to 5 lines. Majorly, the palmistry person, he's going to recognize whether it is the what is your success, what is your education, what is your marital life, what is your the goodness and success. All will going to come to know this. But however, seek the palmistry. I don't advise you. You just go and search for what is your future. The future comes abruptly. The future comes naturally. But don't wait for that. But definitely, each and every person in the life, you will get the life turning point in one particular time. Please use it appropriately. But the person is today is the empty person. The person is today is the poor person. The person is today is the doing the very, very weak person. Then you remember the reason yourself. You are somewhere is lacking. God give the opportunity to all of us, but every human being having only the 24 hours, who is the richest man in the world, but he to have 24 hours. Who is the poorest person? He to have only the 24 hours in a day. But how many minutes? 24 hours, 11 minutes to be known as a per day. But everybody having the same. But how to take up to the extraordinary level about your life is very crucial. That's the reason. Please do the dedication. Please do the forward. But don't think that I may happen, may not be happen. Everything may happen, inshallah. So in that quote, main palmar crease, or this crease also to be known as a, this is the heart crease. This crease known as a heart crease. So this heart crease is existing here. That's called as a main palmar crease. Then you just semi-flex your palm. Semi-flex your palm. Then you can find there is a medial. This is a medial side. This is a lateral side. Radial side is the lateral side. This to be known as a medial side. When the medial side, you can find the crease, ends the palmar crease. Then you can find the bone called as a, there is the fifth metacarpal head of the metacarpal bone. But this to be known as a, this finger to be known as a head of the metacarpophalangeal joint. Whereas in this to be known as a head of the metacarpal bone, not the phalanges. This to be known as a phalanges. This to be known as a carpal bones. This to be known as a wrist bones. But now the carpal bone, head of the fifth metacarpal bone, in the depression the point is located. Remember, I'm giving you the very, very micro level information because my experience teaches you. But where the point is not on the crease, the point is located just distal to the metacarpal head of the metacarpal bone. In the depression, the point is located. To identify that point to be known as SI3, here is located. So hopefully you understand that. So then SI3, the point is that is the mother point, and also shoe stream point, and also there is a point called as a wood point as well. The nature of this point is wood point. Then further, the since being a mother point, and also this is the command point, and further this is the master command point for the coupled organ, master command point for the copulo-conventory organ, that to be known as the confluential point for the my meridian. Confluential point or connecting point or the communicating point to the spinal cord meridian. Spinal cord meridian to be known as a zero meridian to be known as a, there is a do my meridian or the governing vessel meridian or the back midline meridian. Numerous names are there for that. But hopefully you understand one sequence which is coming from the spinal cord where it starts from the Chang Chiang and then completed as the mouth inchio, that is DO28. It starts from the anal region, then it get terminated below the philtrum of the below the no under of the mouth. So hopefully you understand this is the entire region, small no spinal cord. The spinal cord related problem, for example, woman is coming, is a strange woman is coming for the treatment, woman, then she's complaining about the back pain, then immediately you are telling that yes, there are the certain points which we call as a, there is a Chang Chiang, and then further is the Ming Men, and then Yao Yang Chuan. All our points are DU1, DU2, DU3. DO4 points, that points are really good point to treat for the back pain, but ask them to the lie down prone position and then apply the needle, she don't feel comfortable. Then you wanted to use something different, then you can use the point SI3. SI3 point to be activated on the right side. You just apply to the woman, and then there is a combination point to be known as a Shenmai. That is SI3 and then UB62. Both the points are good point to treat. But however, I'll give you a lot of techniques to treat without using the back points to treat the back pain. But definitely there is the one single point will going to help you. That points are numerous points. However, but you can understand the hook C SI3 point bilaterally. Even the Chinese teacher Lao Sha told me, even I have seen in my naked eyes how they are treating when the patient comes like in this way. The patient came, yes, how the so tung tian the yao yo yao tung means is the back pain, yao means is the back, tung means is the pain, yao tung here. So therefore, then he just activated the point to be known as a one point is SI3 bilaterally, and then is the Renchung. Renchung is the DO26. Then further, he just applied 3 points and then activated by electrical stimulation. Then now you just walk. Then he started walking easily. So in that way, definitely that have the positive impact. The woman is coming, you are unable to treat, then you can see the magic. So by activating that point, or you wanted to point only the shanting. Shanting is the chanting. The point is connected to here. That point to be known as a DO23, DO24. This point, you just activate the one single needle, ask them to walk. The patient feel more happiness that now I got some kind of the relief. So in this way, definitely this point will be helpful to treat for. That's the reason confluential point for the back pain. But today the people are really suffering. No doubt there is the IVDP, intervertebral disc prolapse is there. That time I just use only the SI3. This is okay. You will be all right. But no, that pain is something is different. The normal pains are different. There is the chronic mechanical pains are different. But there is only some kind of the spasm, acute to subacute pain. Even chronic condition also you can use this point. However, SI3 is the great point for what condition? For the cervical pain, for the scalp pain, for the back pain as well. The entire spinal cord to be regulated by activating the single point, one point to be known as a SI3. So hopefully that's the reason this point is very, very helpful for the lower back issues where the point is located in this region. Now further we will point to be known as a so SI4. Saraswati. So SI3, SI4. SI3 further you can understand this is the great point where exactly the junction of the white and black skin half tube needles according. Then further, there are the point called as a Wangu. Wangu is nothing but is the bone, which we call as a SI4. The Shou Wangu, Zhu Wangu is the different. Shou Wangu is the different. Wangu, Wangu, Wangu means in Tamil, please come. Right. So Wangu, the pronunciation is W-A-N-G-K-U. Wangu, the pronunciation is Wangu. Where the point is located? In the depression at the junction of the base of the fifth metacarpal bone, in the depression the point is located. That point to be known as a SI4. So SI4 beautiful point to treat for the numerous condition. How there is the this point is belongs to the source point. Whereas in SI3 is equivalent to the Yang4, that is the GB38 micrometers. Right? SI3 is equivalent to the, that is wood point. Wood point is indicating taking the energy from the gallbladder. GB38 is equivalent to the SI3. GB38 is the sun point. SI3 is the mother point. So it takes energy from the gallbladder. Remember, that's the reason. That's the reason you wanted to use the point which we call as a gallbladder, and then is the small intestine is the meeting point to be known as SI3. So hopefully we can see where the SI3 point is located. So we just use the point SI3. Where is the bone? Inside the bone in the depression, you just apply, ask them to take the deep breath while inserting this needle. So this point to be known as a SI3. Now I just applying to the SI4. So where the SI4 is point is located, you just press this. You just press to the metacarpal bone in the depression, metacarpal bone in the depression where the bone get terminated. SI4 point. You just apply this point, SI4, take the deep, ask them to take the deep breaths. Yes, SI4. So these are the 2 points are really good point to treat for the all the neck related disorders. By the way, this point is helpful for to treating for the jaundice as well. Even the authors used to write this point is useful for the yellow color jaundice. Maybe there is a problem is connected to the spleen, also responsible to get the jaundice, and also because the spleen color is belongs to the yellow according to the TCM, whereas in there is the green color is related to the liver and gallbladder. So therefore you understand this point is helpful to treat for the jaundice. Along with that, the scapula pain, along with that is the shoulder pain also treatable, since the point is belongs to the source point. What does it mean is the source point? What does it mean the luo connecting point? Come on.
Communicate together.
So where exactly there is a luo? Luo is the passage or the door or the connectivity, right? Luo means in Chinese terminology, it says the passage. When you wanted to come to this place, but there are the two portals are there. One on the road you came, there is a one gate is existing in the entrance. There is another gate is there that's called as a door is there to enter to this hall. So that's called as a passage. That's the door. That's a connectivity to the coupled organ. Whereas in source point is receiving the energy from the coupled organ. It receives the energy from the coupled organ. What does it mean? Which is the coupled organ now? Heart. It receives energy from the heart and passing energy to the small intestine. That's the reason this most crucial point to treat for the, since the energy is receiving. Source means always you remember, that means we are I'm getting the energy. Hey, ಎಲ್ಲಿಂದ ಸೋರ್ಸ್ ನಿನ್ಗೆ ದುಡ್ಡು ಎಲ್ಲಿಂದ ಬರುತ್ತೋ, ಎಲ್ಲಿಂದ ಸೋರ್ಸಸ್ ಯಾವ ಕಡೆ ಮರ್ಕಿದ್ಯಾ ನೀನ್ ಕೇಳ್ತಾರ ಇಲ್ವಾ? ಅದೇ ತರಾನೇ the source are coming to the small intestine. That's point to be known as SI4. But you wanted to communicate, you take the alarm. Where the alarm? Where you wanted to take the signals. Hey Baba, I want this SI4 is the source point, but yes, I get the energy to the my small intestine, but from where? There is the heart. Heart is the coupled organ. You give the command to that also. That command to be known as a nexary point. Nexary is nothing but is the luo connecting point. That point to be known as a Tungli H5. You apply H5 and then apply the SI4 together. That obviously having the great results to treat for the colon and then cardiac related disorder. However, you know there is a Li4, the Hogu. Hogu point is good point to treat for the many conditions, since that point is belongs to the Li4 is belongs to the source point of the colon. That's the reason the point to be known as a dorsal interior muscles. The point is located that's communicating to the cecum. Cecum is nothing but is the last point which is communicating to the cecum, and then is the appendix communicating point to be known as a Li4. So that's the reason this is the good point for the constipation as well, isn't it? So hopefully we understand here is the SI4 is the Wangu for treating for the jaundice. Along with that is the point to be known as the scapula and then shoulder pain. Remember again the jaundice were related to the bilirubin, biliverdin, direct bilirubin, and get alkaline phosphatase, get excessiveness, that's called as the liver enzymes, get excessiveness. No, 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 just I'm using, and our professor told me you just apply SI4 is enough. But SI4 is enough, okay, but still as a supplementary you can use it, but still we try to rule out by doing the another one time investigation to understand, yes, maybe jaundice is existing or not. The nails appearing is the yellow or papilla and also palate. Under the above the mouth region, try to find out this yellow pigmentation is there. Teeth, you understand, is the yellow pigmentation is there. Palm, you just see the yellow pigmentation is there. Nausea and vomiting sensation is there, is the sign of the jaundice as well. Then further there is a skin derma allergy condition. I get some very itching, so I never get itching, but now I'm getting itching. Then it is indicating there is a bilirubin, biliverdin, get excessiveness could be the reason where the jaundice is existing. So therefore, you need to treat by using that point. Along with this point, obviously, we ask them to consult one hepatologist as well, or maybe one gastroenterologist as well, or maybe some kind of the modern medicine physician. We take the support. If it goes to the higher level, then it causes the health will be hazards, health will be jeopardy. Then further we'll point to this point to be known as SI4. I'm talking about the SI3. So SI3, which side you wanted to apply? However, practically, I'll try to tell you which side you wanted to apply SI3. There are the 4 points are there where the called as a Chiksi Shenmen, that's Huxi Shenmen, Lichu Shohai. There are the 4 points protocol is there. That protocols need to be applied. One is the right side, the other one is left side, vice versa is there. I'll try to tell you those points during the practical section. The fifth point to be known as a Wang Fu. Yangu, right? Wangu is over, right? நீங்க வாங்கிட்டீங்க. இப்போ நாங்க Yangu. 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 ಸರ್ ಯಾಕೆಲ್ಲ ಇದೆಲ್ಲ ಹೇಳಿ ನಮ್ ಸಾಯಿಸ್ತೀರಾ ಸರ್ ನೀವು ಚೈನೀಸ್ ನೇಮ್ಸ್ ಎಲ್ಲ ಹೇಳ್ಬಿಟ್ಟು, ವಿಚ್ ಇಸ್ ಅನ್ನೆಸರಿ ಫಾರ್ ಅಸ್, ಬಟ್ ಸ್ಟಿಲ್ ಇಸ್ optional to you all, optional, right? But maybe see, if you listen 1 year, the next you listen only this year, but next year you're going to pronounce yourself, since I used many times this name. I think Leena and Jayashri all writing in the book that is called as a Chinese pinyin names during the internship. I'm very happy that you people are writing Chinese terminology because they are familiar that whenever I'm telling you, they're taking to their respective mind. So now the Yang Ku, this to be known as the on the ulnar aspect of the wrist in the depression, just distal to the styloid process of the ulna. There are styloid processes, the two styloid process, one to be known as a radial styloid process. This is the radial styloid process. This is the ulnar styloid process. So now just to distal to the styloid process, where the bone called as a hamate bone, where the bone called as a this is a hamate bone. SI4, the point is located on the hamate bone. Where are the how many total wrist bones are existing? 8 bones are existing. Where the H7 point is located? Very good. So where is the Taiyuan? LU9 point is located. Scapoid bone. Where is the SI4 point is located? Hamate bone. Where SI5 point is located on the tricutral bone. But all are not necessary, but still you wanted to keep it in the mind, that will be really good. You know location, that's quite enough. But still you wanted to know, please learn. So now the fifth point to be known as a just a distal to the this is the point is the styloid process, just distal to this point to be known as a Amma, now I take the right decision on the right time. No, SI5 is the good point to taking the decisions appropriately, right? So therefore, when I am lacuna, sir, ನೀವು ತುಂಬಾ ಕುಳ್ಳ ಡಾಕ್ಟರ್ ಸರ್, ನೀವು ಚೆನ್ನಾಗಿ ನೀವೇ ಹಾಕೊಂಡು ಬಿಡ್ತಾ ಇದ್ದೀರಾ ಎಲ್ಲ ಪಾಯಿಂಟ್ಸ್ ಅಂದ್ಬಿಟ್ಟು without practical. But however, this also necessary to me too, isn't it? So just applied this point is a sign. 5 is the good point to take the right decision on the right time. However, this will going to help you. By the way, this point is neck pain and also hand, wrist and febrile diseases, but this belongs to the, there is the musculature that's called as the external reticulum. There is a band is existing on the wrist, there is a band is existing on the ankle region. How there is the bangle you are using, how there is a knot or some kind of the chain you are using to the wrist region, but that also will give the protection. By the way, Almighty God already he has done put it one chain, the chain to be known as the extensor retinaculum. Retinaculum is the band. That band is because 8 bones are there, very small bones are there. Those bones, I think we do have the anatomically in our smaller bones are there. Those bones are known as a to protect, to control, and to monitor or to regulate that on the appropriate place. The friction not to be taken place. Wherever is there, Baba, tum udari rana, pisilna nahi. You should not escape from that place. That's the reason God made that retinaculum. That retinaculum is banded to all the wrist bones, and also for the ankle retinaculum also is there. For the how many bones of the ankle bones? 7 bones, whereas in 8 bones are there. So this to be, there, this point will be helpful to regulate that retinaculum, and also this is the point called as a Horary point. Horary point is indicating self-governing point, self-motivating point, and the self-defensing point of that particular meridian. Now, for instance, we don't have the energy of the small intestine, but what about do? I'll repeat now. SI1 take energy from the colon, large intestine. SI2 takes energy from the urinary bladder, and SI3 takes energy from the gallbladder and small intestine. SI4 heart and small intestine. SI5 Baba तुम्हारा तुम्हारा कुछ भी मुझे जरूरत नहीं. I don't want anything from you all. But I wanted my problem, I wanted to segregate my own. That is indicating a small intestine 5 is only the responsible to treat for the small intestine without taking energy or help from the somebody else. That's called as the in-house point. That point is belongs to the fire point. That belongs to the fire point. So therefore, the element, the small intestine belongs to which element? Fire element itself. So hopefully you understand. So this point will be helpful whenever you find a small intestine energy is deficiency. That due to that reason, I'm getting the neck pain and other related disorders. You just use the SI5 point is good. By the way, hot and hotness is not two difference. Heat is there inside our body. The hotness you can execute. Yes, I do have the hotness. Oh my goodness. You have the excessive hot on your hand. So hot in your body. Hotness is related to the inflammation, but heat is existing internally, the degree of the hotness that to be known as a heat. So therefore, heat is belongs to the it's now what we call as a small intestine and this, but hotness is belongs to the yes, some kind of the inflammatory markers is existing. That time we try to recognize there is a pericardium. Yes, obviously, because the heat and hotness both. So you wanted to add up the another one point also as a, for example, now I told you which point you belongs to. SI. Yeah, P7 has 7, both you wanted to apply, you can apply at a time. Has 7, P7 both, because both are belongs to the sun point. So hotness and heatness is not two difference, but however, there is a metaphysical organ to be known as a pericardium. No, you tried because we do have the two different pulse. There is a small intestine pulse is different from the triple warmer. If the triple warmer is there, don't test to the small intestine. If you feel that small intestine symptom also existing, then you can incorporate it both. Otherwise, you can add up, because triple warmer is different, but this is a different. But it works for the elements is the same. Elements is the same. That's the reason you can use any one. That also works. So this is the extensor retinaculum, which I told you. Where is the band? Then SI5 to be known as a young love. What's the time now? It is 12:30. In complete Martina no? SI6 is the young love. Young means the organ. That means the fire. Love means the old age. Bring the energy for the aged person. This point to be known as a palliative care point. Whenever you wanted to see the senior citizen, then don't forget to applying this point to be known as a young love. That is SI6. Where the point is located? Where the point is located? Yes, SI6, the point to be known as a this the what we call a styloid process of the ulna in the depression. When the hand is this as a supinization, this as a pronation, this as a this as a this as a this as a pronation. That means I am lying down like this. Upside down is the prone position. When I am lying down like this is the supine. Supine is the spinal cord position, and then prone position is the where the facing. This as a supine position. This as a prone position. When the hand is pronated, when the hand is pronated like this, then you find out there is a what we call as a the styloid process of the ulna. In the depression, the point is located. In the depression, that point to be known as a young love. This all the aged persons, you wanted to apply this point will be really fruitful. Then you remember whenever we wanted to use this called as a remic point, this known as a C cleft point. Remic point or the C cleft point or the cleft point itself. So therefore, the acute condition of the any kind of the small intestine related issues, you can use this point. This will be really helpful for the acute condition of the cervical spondylosis. Cervical spondylosis. Then you remember the pain is suddenly started. The pain is suddenly started. Then the point to be you just activate is SI6, but SI6 rapidly activate. This will be really helpful to treat for the cervical pain. Right. So then further this point is to treat for the hemiplegia and many lumbar pain and many indications. Even for the SI6 is good point for the vision related disorders as well. This is a supplementary point, supportive point, because the interior energy pathways is communicating to the Qingming. Qingming, Sanzo, Miqing, Chuchai, Wucho, Chengguang, Losho, Tianzhen, all are connecting to the vision, the prefrontal cortex of the vision. There is a visual cortex of the brain. These points are internally connecting. So therefore, SI5, SI6 is the good point for the vision as well. There is another point to be known as a Chin Chin, where the point is located. SI7. Fichon proximal. And now I'll just proceed little faster. SI7 to be known as a Fichon proximal to the SI5 point on the posterior border of the ulna. There is the ulna bone touch and then feel. Now there is a depression. The touch and then feel, and there is a depression. The depression to be known as a SI5. 3 chon plus 2 chon. Fichon proximal distal. No, that means the posterior border of the ulna, the point is located. This point to be known as a amazing point. But all the nervous weakness in the hand, please remember, all the nervous debility of the hand can be treatable by activating to the SI7 point. That's called as a pronunciation is not the Zizeng. Zizeng is not this pronunciation. Chin Ching. Chin Ching is the right pronunciation for the SI7. Chin Ching. So hopefully the weakness of the joints and pain in the elbow and also neck stiffness. But however, this point is really important. Remember, if any problem on the hand, the nervous related disorders, don't forget to apply this point. Now, the point to be known as a Xiao Hai. Xiao means is the small, Hai means is the connectivity, small connectivity. So about the small intestine, small connectivity, that point is located as SI8. Where the point is located, so you try to find out this to be known as the olecranon process of the ulna. Then this to be known as the medial epicondyle of the humerus.
Rupees
But touch for both the
500
bones.
received on
Touch to
phone
both
pay.
the bones. And then midway between these two, there is a hollow to be known as a CFI. Now I'll repeat again, where midway between the two bones, one to be known as the olecranon process, the second olecranon process of the ulna. That means the ulna bone, it starts and then terminated here. Ulna bone starts here and terminated here. Then further, there is the medial epicondyle of the humerus. The humerus is this bone. This is the humerus. From the humerus, you just come down. So this to be known as a medial. Medial means is the inside. This to be known as a lateral epicondyle of the humerus. This is the medial epicondyle of the humerus. So medial epicondyle of the humerus and then olecranon process of the ulna. You touch in between these two. You touch with these two bones. You touch with the thumb and then middle finger, and then you touch with this first finger. In the depression, that point to be known as a Xiao Hai, that belongs to the sun point, that belongs to the sedative point, that belongs to the depletion point, that belongs to the earth point. Now SI5 is equal to the Chixi, that is stomach 41. The points are called as a stomach 41 is equivalent to the SI8. Once you apply SI8, the energy which is existing excessive heat in the colon, that also regulating to the stomach heat. That means stomach 41 is equivalent to the SI8 point. So SI8 is the sun point, but stomach 41 is the mother point. It nourishes energy to the stomach, but it takes energy from the small intestine. Right. So small intestine energy drain out, that goes. Now what indications, sir? This point is located here. So then you understand the people who are suffering for the elbow pain, the people who are suffering for the golfer's elbow. But golfer's elbow is this. This is a tennis elbow inflammation. There you just apply SA8 point also. Then Shanghai, that is a H3 point also. Good point to treat for the golfer's elbow. So hopefully SI8, the people says I do have the burning sensation on my chest region, burning sensation on my stomach region, on my epigastric region. After eating food, I'll get some kind of the burning. Then you remember the mild to moderate burning is different, but because of the excessive secretion of the hydrochloric acid, or maybe there is a problem, you had the spicy food, you had the hotel food, but you had something is the pani puri, masala puri, or excessive level you had it, that time even patients will get burning sensation. That time you just use this point to deplete that fire which is existing in the stomach. So therefore, SI8 point is good point for the epigastric burning. By the way, there is some kind of the burning sensation on my hand region, on my shoulder region. I do have the burning. That burning can be depleted by activating this point. Now I'll just quickly proceed. That point to be known as the Chiansen. Then we'll go for the practical. There practically I'll try to teach you more, which is connected to this, related points. Chia means is the shoulder. Chen means is the true shoulder to be known as a, that is called as a Chian Shen. Remember, now the point is located one chun proximal to the posterior axillary fold. So this to be known as the anterior axillary fold. This to be known as the axillary anterior fold. But the great point is located, the point to be known as a bypass. But something is extraordinary point. That point is located here on the anterior axillary crease. But by the way, the point to be known as a here, the posterior axillary crease. The posterior axillary crease, from there one thumb proximal to that region, one thumb above to that region. You can have a look in the presentation also. That one chun proximal to the, there is the posterior axillary line. that point to be known as a true shoulder point as well. But that point is treatable for the posterior side of the shoulder pain. But I am unable to take my hand to the upward direction, backward direction. At the same time, I am unable to lift the extension of my hand. So 90 degree or maybe 180 degree I am able to do. That time you wanted to apply as a supplementary point using SI9. Remember, is the key information related to this. Anything related to the hand muscles, the anything related to the hand muscles called as a teres minor muscle. These muscles called as a there is a posterior deltoid muscles, but however, the appropriately that muscles called as a teres minor muscles. These muscles called as a latissimus dorsi muscles. If these muscles having some kind of the pain, or you remember any kind of the hand muscles, extensor muscles, or the flexor muscles, or the digital muscles, or interosseous muscles, or the levator, the muscles which called as a there is a radius that's called a palmaris longus muscles, palmaris flexor, corporalis muscles, any kind of the muscles having the pain, that time you just apply the SI9. Hand muscles are regulated, even Dr. Selvi, but since as a MPT, Master of Physiotherapist, you deal with all the locomotor disorders. But remember, whenever we wanted to use as a dry needling, don't forget, but just superior to that for you is extra information. SI9 point is there, but just to tune proximal to the SI9, that's called as a motor point of the muscles called as a teres minor muscles. But the point is located on the teres minor muscles here. But however, the prominent, what is the motor point? What is the actually sensory, Hashi point? Where exactly the insertion? Where is the origin of the muscles? Midway between the two, the central point to be known as a motor point. So therefore, you wanted to use that particular point to tune above from the SI9 point. That will be helpful to treat the release of the muscles called as the teres minor muscles, kind of the some kind of the stagnation, some kind of the blockage on that region. Due to that reason, you recognize that there is a spasticity is there, or plasticity is there, or the power is the out of 5, maybe 1 power, 2 power, 3 power, 4 power, 5 power. With the stagnation is there, you can activate for 30 seconds. When the twitching to be taken place, withdraw the needle. That's quite enough. In 30 seconds, even in our center, I treat the single point by using the 1 second, 2 seconds. So retention of the needle, how many seconds? Maybe 1 second I do the retention. Within that, it takes me 1 second to apply. It takes me 1 second to rotate and 1 second to withdraw. Within 1, 2, 3 seconds, I just complete the one needle. So I don't take more than that. But maybe that even retention of the needles for 30 minutes. No doubt on it. But certain points I just activate within 1 second to activate that point and then withdraw quickly. That's called as a hand pricking method. That's called as a insertion, quickly withdrawing method. All these things you learn, all of you. In the Zoom also I request you. You people also I'll request you. All of you come for the internship. And whenever it is possible to you to take up the time, then you practice this, and however you will gain the confidence of the acupuncture. So hopefully where I was, the Chiansen is the SI9 point to treat for all the muscles which is connected to the shoulder and then hand muscles. Now come to that conclusion. SI9 to SI7 for the nervous debility, SI9 for the muscular debility can be treatable by activating the 2 points. Then the now show, remember, is the groom. Groom is the now show. Who all are here is getting groom. So we are the old grooms, isn't it? How about new generation grooms? The grooms to be known as a now show. Now show एक point बनाकर हूँ, RS एक point बनाना, RS एक point बनाकर इधर mention करता हूँ. ठीक है. Now show point to be known as a SI10, where this point is located vertically above to the SI9, just distal to the supraspine of the scapula. This point, spine of the scapula, the point is located, that point to be known as a SI10, directly above the SI9, and then the point is located just distal to the spine of the scapula, where the acromion joint is there, just distal to that point to be known as a SI9 point. 10 point is the now show. But however, this also good point. Whenever there is some kind of the shoulder mobilization is not happening, there is called as a adhesive capsulitis, or maybe some kind of the what we call as a what we call as a frozen shoulder, right? Even that condition also this point will going to help you. Then further uh, there is a point called as a Tian Zung. I love this point, is the too much, so that point to be known as a Tian Zung SI 11, where the point is located upper 1 by third, lower 2 by third of the pit of the scapula, and also there is the supraspine of the scapula where the point is located. Remember this to be known as the spine of the scapula. So this entire line, this bone to be known as a spine of the scapula. You can see this. ನನ್ನ ಕರ್ಸರ್ ಮಾಡ್ತಾ ಇರೋದು ಗೊತ್ತಾಗ್ತಾ ಆಯ್ತಾ ನಿಮ್ಗೆ? This to be known as a spine of the scapula. Now where the point is located, so pit of the scapula means the lower margin of the scapula. How to do that? I'll show you practically how exactly find out the pit of, because lying down you cannot find out certain things. You have to find out in the different anatomical positions. That position I'll try to show you where exactly is located. This SI 11 point is the Tian. Tian means the heaven. Zung means the penetrating heaven. Heaven is the gathering of the heaven. Gathering of the heaven. So now the point is upper 1 by third of the spine of the scapula. The point is located where you wanted to do as a triangle. Triangle you can do. So this is the SI. This is the point is SI. SI 11. This point is SI 9. This point is SI 10. You make it as a triangle. This point is SI 9, SI 10, SI 11. So these are the 3 points works as a triangular level, but these 3 points also good point to treat for the scapular related pain. Then further, by the way, Tian Zung the point. Remember the point called as the equivalent point, that is the anterior front line. Most of the times I say this is the vulnerable point to be known as a Ren Ru Chung. Ru means the breast, Chung means the center. That means the breast center point to be known as a stomach 18, isn't it? Stomach 18. The stomach 18 point, unable to apply that point directly because that is the vulnerable point. You wanted to use the opposite point, or you wanted to use the parallel point for the any kind of the breast related disorder, any kind of the Birett's related problem, then you just use the point. Even for the ladies you are unable to apply, no doubt there are the few points are very important. That's called as the Ingchuang, Ruchen, Rujen, Burang. These are the 3-4 points are really great point to treat for the nipple and also the breast. The front side the points are located, whereas in opposite side or the parallel side you just apply the point to be known as a SI 11 is the single point will going to help to treat for the all the breast related disorders. Any kind of the breast problem you can add up that point as well. Where the point is located is the Tian Chung point. SI 11 is the upper 1 by third. On the level of the fourth thoracic vertebra, this point is located. Then further we're going to see that this is the posterior side of the muscles. What are the muscles are existing? I told you teres minor muscles, infraspinatus muscles, supraspinatus muscles. This is called as a spine of the scapula. This bone to be known as the spine of the scapula, and this to be known as the acromion. This as a ACL joint, acromioclavicular joint. This AC joint. This is the clavicle. Right. You can have a look. There are the 3 muscles are on the backside of your spinal, backside of your scapula. One to be known as the back of the shoulder is teres minor. Remember. Then the infra means below. Below the spinatus muscle to be known as the infraspinatus. Below, above the spine of the scapula to be known as the supraspinatus muscles. Then the muscles which we call as where exactly this is the superior border of the region. This called as a levator scapula muscles. Now the points are coming here. Let me see where circumflex scapular artery also moving here. Now SI9, this is the triangle which I told you. SI9, SI10, SI11. There are the triangle points. You can have a look. Then SI12 point. SI12 point known as a Bing Feng. Bing Feng. Yeah. Bing Feng is the grasping the wind or the gathering of the wind. There are the certain 12 points are there, wind points in the body. Wind means is the obstructive painful syndrome. That's called as a painful obstructive syndrome. That the wind is nothing but a feng is nothing but kind of the wind. So those wind conditions, we can use the point to be known as a Bing Feng, where the point is located just vertically above the SI11 on the superior margin of the supra spine of the scapula. Supra spine of the scapula, this point is located. You just have a look. We're going to see practically where this point is located. However, this point is good point to treat for the shoulder and the scapular pain as well. And also the muscles called as a upper trapezius muscles. Right, this muscles called as a upper trapezius muscles are three types: upper traps, middle traps, and the lower traps as well. So this points called as a upper traps. We can trapezius muscles, short name to be known as a traps muscles. Then the Chu Yuan, where the point is located. So this point is located on the medial end of the spine of the scapula. The point is located. Now you can have a look here where the spine of this is the spine of the scapula, and this is the medial. Medial means towards the spine. Medial side means towards the spine. The point is located here. That's called as a SI13. Right, Chu Yuan. There are the 3 points are existing: Chu Yuan, Tian Rang, and Qian Qing. GB21 and Sanjo 15 and SI13. 3 points are there on the same shoulder related issues can be treatable here. But these points are non-command points. These points are non-command points. It works on the particular area. It works on the particular adjacent area to treat for that illness. Then the point to be known as a SI14. SI? Correct. Then Qian Y Shu. Qian means shoulder, Y means outside, Shu point. Shoulder outside point to be known as a Qian Y Shu, where exactly the point is located. 3 chun lateral to the lower border of the spinous process of the T1. 3 chun lateral to the. Remember, there is a Fu Fen Po Hu Ka Huang Chi Men Hun Men Tianshu. The points called as a Poof and Pohu Kwang Kwang. UB 41, 42, 43. Where the UB 41 is located? Anyone? Good. Okay. Now where this point is located? Correct. GB21 is SI13. SI14. Yes. UB41 point is located 3 chun lateral to the spinal cord on the second thoracic vertebra. But this point is located on the first thoracic vertebra. That is the difference, right? So now Chia, Y, Shu, the point is located 3 chun lateral to the spinal cord, lower border of the caudal spinous process of the first thoracic vertebra, because UB meridian starts from the second thoracic vertebra, not on the first thoracic vertebra. That's the reason UB SI14, the point is on the first thoracic vertebra. This is also good point to treat for the shoulder related issues. Then SI15. SI15 is the Qian Chung Shu. Qian means again shoulder, Chung means is the center, Shu means is the point. Where the Qian Chung Shu, the point is located 2 chun lateral to the lower border of the spinous process of the 7th cervical vertebra. 7th cervical vertebra to be known as the, that is the Qian Chung Shu. That point is also good point for the cold and congestion, asthma, hemoptysis. Hemoptysis means the bleeding through the mouth as well. Yes, these are the trapezius muscles. Then you can have a look SI14 and SI15. How is it located here? Then Tian Chuang. Coming points are really, I love this point. Tian Chuang. Tian means heaven or cosmic. Tian Chuang is the kind of the gathering, is the connectivity. 3 points you remember, that one to be known as a Renning, Nekfutu, and then Tian Chuang. 3 points in the one line, Tian Chuang. The 3.5 chun lateral to the Tian Chuang, where the point is located, 3.5 chun lateral to the Adam's appeal on the which muscle? On the border of the posterior border of the sternocleidomastoid muscles, SCM muscles, right? This point is located 3.5 chun lateral. 3 chun lateral is LI18. 3.5 chun lateral is LISI16, that is called as a Tian Chuang. But this point is the nerve which is passing from the brain to the anus region, that to be known as a vagus nerve. So how to be activated vagus now? The whole body will going to shake. Whole body will going to shake once you activate to the vagus now. That will going to see in the practical how will going to happen. So hopefully the entire body, from the pain also coming parallelly. So that's the reason we should be very careful by activating that point. No doubt there is a thyroid artery. No doubt there is the neck arteries are coming and ascending direction to be taken place in this region. That's called as internal jugular vein. External jugular veins are coming downwards direction. There are the jugular vein are how many? Internal, external, anterior jugular vein as well. So therefore, there are the three venous system is existing here. We should be very careful. There is another called as a subclavian vein. Subclavian vein divided into, again is the external jugular vein, and brachiocephalic vein. The brachiocephalic vein is connecting to the internal jugular vein. External jugular vein is a subclavian vein. The brachiocephalic vein coming supporting to the internal jugular vein. But however, this anatomical aspect, you just keep it in the mind. That is a good luck of you. What you are doing. Yes. No, you wanted to send to somebody heaven, you can do it. That's what I told you, no? Yeah. Now I'll tell you that. Now the Chuan Leo. There is another point is very Tian Rang. Tian Rang. Tian again is the heaven. Tian Chuang, Tian Rang is the heavenly point, lovable point. That means is the love hormone will going to release by activating this point, which is the love hormone.
Love hormone.
Only oxytocin. Happy hormone.
Dopamine.
Hormone.
Oxytocin.
Dopamine.
Yes,
Oxytocin.
this will be really helpful for, because there is a people says I do have this some kind of the strange feeling. Numerous things are there with this, and definitely this will going to help you. I'll try to tell you that very soon. The Tian Rang is the good point to treat for the, there is a auricular related disorders, and also there is a pharynx and then larynx related disorders. Pharynx and larynx. Pharynx means is the tonsils, larynx means is the voice box or the vocal cord. So therefore that related disorders, since the point is located on the anterior to the sternocleidomastoid muscles, that point is also good to treat for the neck pain as well. Right. Then the point to be known as Chuan Leo. Chuan Leo, the point is exactly where the point is located. Do you know Alanasi? You bring the Alanasi. Ouch. The point is SA 18, somewhere is there. But you bring down the point to be known as there is a zygomatic bone. Zygomatic bone, you just come down, touch and then feel. This called as a zygomatic bone. Come just down to that, and this muscle is called as a masseter muscle. This is the muscle called as the strongest muscle in the body. So these muscles, you come down the front of these muscles, the point, the depression, that point to be known as a Chuan Leo, Chuan Leo, Chuan.
Camera,
This is the Sikwan.
camera,
This is the Sikwan.
camera.
Yes. Coming, Larita. No, I love her about her sincerity. Right. Now you can see this as a this as a external what is zygomatic bone. You just come down in the depression, that point. So where exactly now the Bitung is Alanasi. Do you know Alanasi? This is the Alanasi, the superior border of the Alanasi, where the Bitung point is located, where the nose stood. You just apply, no, nose stood is always is good. I think you just come down and then you come down, you can find in the depression, right? This depression, you wanted to get the dimples. Dimples can you apply just distal to that point. I think somebody was asking me. The funny question is the Mona. Mona is asking that I wanted to get dimples. So we just applied the two needles here. So if you wanted to create the dimple for the girls, especially, we can apply the points are here. But however, just proximal to that region or the superior to that region, that point to be known as it. The Chuan Leo is a really great point to treat for all the mastication related disorders, especially for the facial paralysis or Bell's palsy related conditions. You just activate this point, right? Then further, the sinus meridian meeting point, also one of the point to be known as a SI18 point. Now the last point that to be known as a Ting Kang. Ting means again there is the palace, Ting Kang, the palace of the hearing. That to be known as a, there is a tragus. This is a anti-tragus. This to be known, this as a anti-tragus. This to be known as a tragus. There is a curved flip is existing here. That flip, in front of the flip, the point is located. You are yawning or you are opening the mouth. Jhalak. Opening. The condyle is open. Once you open, the condyle of the mandible open. Then you insert the needle. That would be then. Once you apply the needle, applied, then should not immediately close the mouth. Then ask them to close slowly mouth. Then that needle going to settle. That time you should not speak, you should not drink, you should not eat anything. Maybe somewhere applied the points. You wanted to have something, just fatigueness. Eat the, something you wanted to have. Chai, coffee, something you can take it. But here once apply the needle, it's strongly not advisable, inhibitory to use any kind of the eating things or talking. You should not open the mouth. So if somebody wanted to shut your mouth, who is the walkie-talkie or the extrovert like a Jayashri, then we put this needle to stop that. So then she no more will going to talk. So until we relieve the needles. So hopefully the Tingong is the good point. 3 points together. One is the Tinghui, Tingong, Armen, Arjian. These are the points are good point to treat for all the auricular-related disorders where the cochlear nerve to be known as the 8th cranial nerve need to be activated. Then this point will going to support to the child. It's not the totally, because when the cochlear nerve got damaged, then the cochlear transplantation is required. How there is the heart transplantation, liver transplantation, kidney transplantation to be taken place, but however the heart is not transplanting, but the liver, how kidney. Similarly, the cochlear transplantation they do and put it on this on the visual, that is the temporal cortex of the brain, then that will keep on battery to activate that. So once it's continuously activating to the nerve, that nerve to be known as a cochlear nerve. So hopefully this for indirectly will going to help for this condition. So now what's the time now? Exactly is it 1 o'clock? Please, without wasting the time, immediately you rush to the place. We will start the practical.